This is Unit 1, Journal for Mn668. This is my first inpatient rounding on a psychiatric ward, and my patient was a 47-year-old male who had arrived to the ED reporting that he was experiencing heightened auditory hallucinations. His history does have a diagnosis of schizophrenia, as well as he does have some amount of social anxiety in terms of presenting whenever people are present. He says he goes out of the way to avoid any interaction with people. So on our first interaction, the patient was admitted from ED upon crisis evaluation, and then he was brought into the inpatient unit. And he was, of course, appearing disheveled. Although his did not have any motor agitation, no tics, no tremors. His gait was normal. He was seated normally. He greeted us. There was appropriate eye contact. His speech was normal, and his thoughts were linear, yes, and goal-directed too. However, his affect was blunted. He did not report any change in his mood from the time that he has arrived. He said just pretty much the same. And currently, he did not report any auditory hallucinations, and this is because he was placed on Haldol upon his intake. So Haldol was initiated upon his intake, and it seems to have helped him. So he was responding to Haldol 5 milligrams daily. His memory was fairly intact. He is homeless currently, and he told me explicitly that he likes it in the hospital and would like to continue staying here. I think by that he meant that he wanted to live here. So with that, I could tell that his inside was not good enough. I gave him a fair. His judgment was fair because he knew that Haldol was the medication that helped him with his the auditory hallucinations, and he did report that he wants to continue taking it. He also asked for some medication that can help him with his mood, because that seems to be his concern. He felt like it was, looking at his affect, which was fairly blunted, and his local interactions with the people, it seemed like he still had some anxiety. He was oriented, he was alert. So we put him on sertraline 50 milligrams daily once to see if that helps him with his mood as well as his social anxiety. Interesting to note was that his lab came back, which was a blood draw for TSH levels, it came back really low at a 7.0, which kind of made us think that if there is an organic cause for his low moods. So before we put him on any thyroid medication like levothyroxine, we wanted to do a reflex T3, T4 levels blood draw, and therefore we ended up ordering a law, and the results are pending. I'm curious to know what will be the outcome of that, and based on that we'll make a decision on whether the patient needs any thyroid medications. So overall, it is a great experience.